Awesome. Well, welcome, everyone. I am so glad that you have joined us today for Earth Day 2021, and also to celebrate and honor and recognize Dr. John P. Wyatt in this symposium focusing on environment and health. I first want to recognize Dr. Wyatt's family for their generous support to make this event possible. They have honored the legacy of Dr. Wyatt, who was a pathologist, who was one of the first physicians in the United States that air quality and air pollution specifically with lung disease. So this was before Earth Day even began. He was doing this research. So it's an honor for the University of Kentucky to hold this legacy of the connection between environment and health, particularly from a physician's point of view. So welcome to everyone. We're so glad you're here. I want to say that you are joined, I know virtually, but in the spirit of camaraderie. There are over 360 attendees from all over the United States joining us in here in the meeting room today. So take time. There's a chat function. You might connect to colleagues that you may have not seen over the past year and a half. Just to feel a sense of connectedness. So this event also would not have been possible if it, from all of the other support from university partners. Dr. Wyatt left a legacy, a true legacy, because now there are over like 10 environmental groups on our campus. We have 2 NIEHS, which is the National Institute of Environmental Health Sciences, funded centers. One is the Superfund Research Center, and the other is the UK CARES, Center for Appalachian Research and Environmental Sciences. We also have participating today the Kentucky Water Resources Research Institute, the Kentucky Animal Disease Mapping Initiative, the Kentucky Geological Survey, our UK Office of Sustainability Global Environmental Health Initiative. We also have the Center for Clinical and Translational Science participating, the Tracy Farmer Institute for Sustainability and the Environment. So UK is full of wonderful environmental health research and work initiatives, and we're glad to assemble them all together today to make this event happen. I want to introduce now the keynote speaker for the John P. Wyatt Symposium. I am just so honored and delighted to have Dr. Howard Frumkin with us this afternoon. Dr. Frumkin is a professor emeritus of environmental and occupational health sciences at the University of Washington School of Public Health in Seattle. He served there as dean from 2010 to 2016. Dr. Frumkin received his medical degree from the University of Pennsylvania, and also his NPH and DRPH from Harvard University. He's not only an internist and dedicated occupational and environmental health medicine specialist, but he's also an epidemiologist, one of my favorite fields. And now as we go through the COVID pandemic, we realize how important epidemiology is to our life and sustainability. Dr. Frumkin has spent his entire career examining the role of the built environment, climate change, energy policy, and today we'll hear more about that in his talk. Served as the head of Our Planet, Our Health initiative at the Wellcome Trust in London. He's also a past director of the National Center for Environmental Health at the US CDC, and also served as special assistant to the CDC for climate change and health. He has authored over 200 scientific journal articles and chapters, and also over 9 books focused on environment. And today we'll also be including his latest book, Planetary Health, Protecting Nature to Protect Ourselves. We'll be including that as part of a drawing and a raffle for those who complete the evaluation of today's event. We'll be giving away one of his new books. So without any further ado, Dr. Frumkin, welcome to this event, and I'm sincerely looking forward to hearing your talk on planetary health. Thank you.
Erin, thank you so much for that nice introduction, and greetings, everybody. Happy Earth Day to everybody. It's very nice to be together. I only wish that we could all be together physically in beautiful Kentucky, but I know that as the pandemic comes to an end, we will be able to get together in real life before too long, and we all look forward to that. My topic today is planetary health, subtitled Human Well-Being on a Fast-Changing Planet. What I hope to do is introduce you to this exciting new field of planetary health. Before I jump in, I'd like to acknowledge that I'm speaking to you from Seattle, from the traditional unceded land of the Coast Salish peoples, and in particular the Duwamish tribe, which inhabited the land where Seattle is now. I honor with gratitude the land itself and the tribes, and I also want to acknowledge with respect and gratitude the Wyatt family for their support of today's events. My agenda is very simple, just three pieces. I'd like to introduce to you the paradigm of planetary health, work a few examples with you, and then end on a hopeful note, because after all, when we ponder the state of the planet, it can be a little gloomy, but we need to maintain lots of hope, and there's good reason to do that. So let's begin by talking about the paradigm of planetary health. And I'd like to ask you, even if you are a health professional, to channel your inner historian and your inner ecologist, because we need to think broadly and long-term about the issues that I'd like to discuss today. I'd like to go over 7 key concepts with you: the Great Acceleration, the concept of deep time, the Anthropocene, planetary boundaries, the donut, ecosystem services, and the concept of polycrisis, some or all of which may be new. So let's begin the story here at the bottom of a coal mine in Scotland in 1860. This is where planetary health may begin. Now, at the time this picture was drawn, coal had, of course, been known for a long time and had been used for over 1,000 years as a source of energy. But at this point, it was being used on a very large scale, making energy available on an unprecedented level and revolutionizing industry. I like this picture because this seated gentleman apparently thought it was appropriate to go to the bottom of the coal mine while wearing his wig, and he's sitting there lighting a pipe, or maybe it's a firecracker, I can't tell which. Not a good idea to do in a place where there may be flammable methane gas in the air, but a nice example of the reckless insouciance that nicely foreshadows the energy economy of the next century and a half. Or our story may begin here. This is 1859. This is the Drake Well in northwestern Pennsylvania, the first commercial oil well in the United States and possibly in the world. Liquid fuel represented another form of plentiful energy that was new, and before long revolutionized transportation and gave rise to a booming synthetic organic chemical industry. Well, all that energy that became available revolutionized the way people lived. And as you can see here, before too long, a couple of decades passed, the human use of energy began climbing dramatically. And most of that energy consisted of coal and oil, and a little bit later, natural gas, which is a kind of an advertising name. It's natural in a sense, but not natural in the sense that many of us use the word these days. And these 3 fossil fuels, which represented embedded energy from immense time in the past, helped us completely revolutionize the human enterprise. One of the ways we did that was by upscaling our population. Population had been relatively stable during the entire Holocene for about 10,000 years, but with the availability of energy, population skyrocketed so that we're now up to almost 3 times what the population was as recently as when I was born. We also scaled up our economic activity. This is a picture of GDP. What you're noticing now, by the way, is that the curves that I'm showing all look alike, a long, flat line, and then a sudden uptick. And this is economic activity, the gross domestic product of the world, and it has skyrocketed as well. In fact, almost any indicator of human activity that we can think of, from the use of water to transportation, fertilizer consumption, our production of products such as paper and plastic, the number of McDonald's outlets, you name it, any indicator of human activity has skyrocketed in the past couple of centuries, and in particular since about 1950, since the end of the Second World War. This scale-up is called the Great Acceleration, and it represents a complete break with the history of humanity. Now, in many ways, this has been a great time to be alive and to be a human. Health and well-being have never been better. These pictures show that illiteracy is dropping around the world. Poverty is dropping even as the global population has increased. child survival has improved, life expectancy has improved. Now, all of these health gains are not equitably distributed, unfortunately, but they are real health gains on a global population basis. Good time to be alive and to be a human. But, and there's a but, these gains have come at a cost, and the cost is being borne by our planet. So let's take a look at the planet. Let's say a few things about the context of the planet. First, by way of setting context, if we scale the planet to the size of a soccer ball, then the entire biosphere, from the deepest ocean trench to the very top of the troposphere, is about as thick in proportion as this layer of cellophane on a soccer ball. It's a very small film on the surface of the planet. If we consider all of life on Earth, all of life in that biosphere, it's about 550 gigatons of carbon is represented in this cartoon. Almost all of it is plants, and animal life represents just a tiny fraction of 1% of life on Earth. If we blow up that animal life, we can see that over half of it is insects, a large part of it is fish, and humans, we represent, again, a tiny fraction of 1% of the animal kingdom. Interestingly, we eclipse the number of wild mammals. That wasn't always the case, but we've changed the balance of life on Earth. And we are overshadowed by the amount of livestock that we maintain to feed ourselves. This gives you a little bit of a sense of how humans have altered the shape of life on Earth. Most importantly, we are a very small part of life on Earth. We can also think about the issue of deep time. The planet has been here for 4 or 5 billion years. Life appeared about 2 billion years ago. Vertebrates, less than 500 million years ago. Mammals, just a couple of 100 million years ago. Primates, just 10 million years ago. Our species, Homo sapiens, about 200,000 years ago. We emerged from being hunter-gatherers to growing crops and writing things down and living in towns just 10 or 12,000 years ago. A very brief time. The writer John McPhee has put it beautifully. Consider the Earth's history as the old measure of the English yard, the distance from the king's nose to the tip of his outstretched hand. One stroke of a nail file on the king's middle finger erases human history. So we are a small part of life on Earth spatially, and we are late arrivals temporally. And you might think that given that brief existence, we couldn't really do much to alter the entire planet. But you'd be surprised. We have. The chemical composition of the atmosphere has changed in the last century or so. The temperature of the planet has changed. The pH of the ocean has changed. The distribution of land uses around the planet has changed. We have lost species at a very high rate. So it's true to say that we no longer live on the same planet that our great-grandparents did. It is a different planet, fundamentally altered. So much so that geologists have suggested that we've entered a new geological epoch. Here is a picture of deep time in cartoon form. This very thin black layer at the top represents the Holocene epoch, the last 10 or 12,000 years since the end of the Ice Age, when civilization as we know it arose. And at the top of that is the Anthropocene, the geological epoch defined by the fact that humans have enormous influence over every global process. Now, that concept of the Anthropocene has also introduced the concept of planetary boundaries. And this is kind of an iconic picture. Let me walk you through it if you haven't seen it before. The notion is that on these 9 parameters, climate, novel entities is a euphemism for chemicals that haven't existed before we produce them as humans, ozone depletion, atmospheric aerosol loading, biodiversity, the way land is used, fresh water availability, biogeochemical flows of phosphorus and nitrogen, and the pH of the ocean. For each of these parameters, there is a boundary beyond which we shouldn't go. If we stay in the green safe zone here, the planet remains stable, and life as we know it can continue, and we can continue to thrive. But if we transgress those boundaries into the red zone here, we risk irreversible system change. And the scientists who developed this framework have actually proposed that with respect to biodiversity, we have crossed the line. We are in the 6th great extinction. And with respect to phosphorus and nitrogen flows, human influence on the flows of those elements now eclipses natural flows. We've changed them fundamentally. Now, you may wonder, where are the people? We can redraw that picture. This is the exact same picture, just redrawn with a big hole in the middle, because those of us in the health professions may be thinking, where are the people? These are all physical processes. So here is a picture drawn with an empty hole in the middle where the people ought to go. Here's the ecological ceiling with the idea of overshoot, and we can insert into it people and their needs. Here's water, food, energy, social equity, peace and justice, all the things that people need. And here is a social foundation below which we shouldn't go. So ecological limits above which we shouldn't go, social limits below which we shouldn't go, and that space in the middle is the sweet spot where we'd like to be. That's called the safe and just space for humanity, a regenerative and distributive economy. This is the model of the donut economy put forward by Oxford economist Kate Raworth. So this situates human health and well-being within the larger context of a functioning world. Now, there's another framework by which to think about the ways in which planetary processes support human health and well-being, and that's the concept of ecosystem services. You may have come across this before. The notion is that when the planet is operating with integrity and in an equilibrium manner, it provides supporting services. Think of the formation of soil. It provides provisioning services, giving us food, water, and other things we need. It provides regulating services. Think of a coastal forest protecting us from floods. And it provides cultural services, like our ability to enjoy the beauty of nature and to be physically active in natural settings. All of these services, as you can imagine, can be mapped to the ingredients of human health and well-being. And that's what's done in this complicated picture from the Millennium Ecosystem Assessment. Here's health, which is what brings us all together today, but it's accompanied by the basic materials for a good life, by security, and by good social relations. And what you can see is that these ecosystem services map directly to health, as well as to other components of a good life. So the bottom line message here, and this is one of the core messages of planetary health, is that we can't be healthy and thrive as a species without having a healthy, thriving, stable planet. And if the planet is dysfunctional, we can't be very healthy either. But as I mentioned, we are not in that situation now. Each of the parameters shown here has changed relatively dramatically in the last century or two, and especially in the last 50 or 70 years, such that we live on a different planet than our grandparents inhabited. But it's important to understand, as we push for health and well-being for all, that it's not only these physical processes that we have to contend with. We also face social and demographic challenges, such as a growing global population, an aging global population, and increasing globalization. These green lines here represent, in the days before COVID, daily airplane flights, an illustration of how closely knitted together we are as a planet. We also face poverty, and related to that, but distinct, income inequality, and racism and discrimination in far too many parts of the world. We also face disinformation propelled by social media. We face increasing levels of populism in the world, and related to that, the rise of authoritarian governments in many, many countries. And we face biomedical challenges as well. Of course, there's the pandemic, but there's also the continued rise of non-communicable diseases and the rise of loneliness and the decline in social capital and social connectedness. All of these things affect our ability to cope with and to manage the planetary disruptions that I mentioned earlier. And of course, as you can well imagine, these problems don't exist in isolation. They interact with each other. That's represented by this iconic picture of a COVID warning sign in California this past summer being engulfed by a wildfire that was potentially contributed to by climate change. So here you've got climate change and a pandemic illness interacting with each other to endanger people. So much so that these interactions are probably best depicted by a picture like this, illustrating the first law of ecology, that everything is connected to everything. This is the notion of a polycrisis. Now, there's one more dimension of our current situation that I'd like to mention, and that is how fast things are changing. So let me show you a couple of slides of the pace of change. This is a picture of biodiversity loss of vertebrate species that are going extinct. And what I want you to notice is how steeply this line is increasing. The rate of extinction is increasing. And these are just for vertebrates. Here, when it comes to insects, the extinction rate is even higher, about 7 or 8 times higher an extinction rate for insects as we have for vertebrates. Here's a picture of ice melting in Antarctica, and you can see that the sea ice loss is accelerating. Here's a picture of glacier loss, and as you can see, it is accelerating rapidly as well. Here's a picture of weather-related catastrophes, rapidly accelerating. So all of the changes that I mentioned, or almost all of them, are not only progressing, but the pace of change is increasing. As that happens, it takes us closer and closer to the possibility of tipping points. A tipping point is an irreversible system change that shifts the state of the world. And that could be, for example, the slowing or stopping of the Atlantic circulation, which maintains climate in much of the northern hemisphere. It could be the loss of the Greenland ice sheet. And these things, of course, interact with each other. The last mention of timing that I'd like to offer you is illustrated by this picture. This is a bit of a complicated picture. This is a picture of various pathways if we are to limit global warming to 1.5 degrees. Each pathway is a colored line, and it differs according to assumptions that we make about the sensitivity of Earth systems to greenhouse gases and the pace of human responses. But what I want you to notice is that every one of these pathways that gets us to limiting warming to 1.5 degrees begins with a downturn in our greenhouse gas emissions right about here. In fact, every successful pathway contemplates that we would cut our greenhouse gas emissions in half by 2030 and get to net zero emissions by 2050. But that's not the path we're on at the moment. CO2 emissions continue to rise. They fell a little bit with COVID and are expected to bounce back as we emerge from the pandemic. So, a complex set of global changes that threaten human health and well-being and the stability of the way we live. These changes are accelerating. We haven't yet triggered the responses that we need to trigger, and those of us in the health sciences know that there is a word for this, and that word is an emergency. Well, one of the responses to this emergency has been the growth of a field called Planetary Health. It emerged with a manifesto published in The Lancet in 2014. The Rockefeller Lancet Commission on Planetary Health published its big report in 2015, which kind of launched the field. There was a Planetary Health Alliance established in 2016. Academic units around the world, London, Sao Paulo, and elsewhere over the next few years. And now, as Erin was kind enough to mention, we have a couple of textbooks in the field. I was honored to be a contributor to both of these. And so this marks the emergence of a field. Planetary health is defined in relatively complex ways, but the simplest definition is shown here. Simply put, planetary health is the health of human civilization and the state of natural systems on which it depends. So let's work some examples now. I want to pick examples that are very quotidian, examples from our daily lives, the energy we use, the stuff we make, and the food we eat, and illustrate for you how a planetary health approach would help us sort through, tackle problems, and protect human health and well-being. Now, in the energy arena, the most obvious example to talk about is climate change. You all know a lot about climate change. You know that with the increases in the use of energy that I showed you earlier, since it comes from burning fossil fuels, that releases carbon dioxide. You all know that the level of carbon dioxide in the atmosphere has increased over recent years. And you all know that that leads to impacts on human health through a variety of pathways as shown here. I actually don't want to talk about climate change, and I don't want to talk about climate change because I assume that everybody on this call knows a fair amount about the impacts of climate on health. And I want to make the point that even if we didn't have a change in climate, the planetary health framework would still be very useful to us. And so I want to use other examples to illustrate that. But I do want to linger on climate change for just a moment to make one point, and that point is shown here. This is a graph of household income in the U.S. from the low-income households to the high-income households, and the carbon footprint shown on the y-axis. What I want you to see here is that the carbon footprint for those of us who are wealthy is much, much higher than the carbon footprint of the low-income households. If you deconstruct that carbon footprint, it can be attributed to food and to housing and to even the clothing we wear and to the way we travel and to the services we use. The wealthy people are responsible for a much bigger share of greenhouse gas emissions than the not so wealthy people. And that's true on a global scale as well. This is a graph of the world's population with the poorest 50% here and the richest 10% up at the top. What you can see is that the richest 10% of the world's population is responsible for almost half of greenhouse gas emissions, and the poorest 50% for only 10% of those emissions. So again, the same pattern. The wealthy are creating much more of the problem than the poor. But the impacts are felt in completely different ways. Here's a map of carbon emissions, scaling countries by their cumulative emissions. So you see a very large bloviated United States, a very large bloviated Europe, and a tiny little vestigial Africa and South Asia. But when it comes to the impacts of climate change, the pattern is the reverse. Few impacts on tiny little US and Europe, very large impacts on Africa and South Asia, where people are so unfortunate. So this is a core planetary health principle, the principle of equity, that those of us who are fortunate have caused a lot of the problem, and we need to be thinking very hard about protecting and elevating people who are less fortunate and achieving more equity as we develop solutions. The energy example that I do want to linger on for a moment is the question of dams. Now, what do we think about dams? Well, if we look at the greenhouse gas emissions of various sources of electricity, you can see here that coal is quite high, oil is quite high, natural gas is lower but still quite high. And if you look over to the right, hydroelectricity is one of the least greenhouse gas emitting ways to make electricity, and that's a terrific thing. I'm proud to tell you that in my part of the world, in the Pacific Northwest, the Columbia River Basin is almost completely built out with these many dams that you see represented by red and yellow dots. And that's why our electricity in Washington State, where I live, is 2/3 hydro. Much of the rest is renewables of other forms, such as wind. So we have a very low carbon footprint, and hydro helps a lot with that. Dams are being built at a very fast clip. There are almost 3 million dams in the world. Most of those are for flooding control and for irrigation, but 3,500 of them are hydroelectric dams, and another 3,700 are planned or under construction, as you can see here. This is Asia. Here's Latin America. The purple dots represent dams that are operating. The red dots are dams that are planned, and the yellow dots are dams that are under construction. So we're seeing a growth in hydroelectric energy. Now, that has human implications. This is the Three Gorges Dam in China, which was completed in 2006. It's a very big dam. It displaced over 1 million people. It obliterated 13 cities and 140 towns and over 1,300 villages. And that was well documented to cause large levels of stress, of mental health problems, of upending people's lives. And that's just one example of the adverse impacts of dams. In fact, dams represent an important planetary health principle, and that's the principle of complex trade-offs. The benefits are many, as you can see here: clean electricity, a dependable water supply, irrigation, flood control, and recreation. But dams threaten health and well-being in several ways. They alter river ecology, they alter the fluxes of various elements, they emit methane, and there are direct risks, one of which we'll come back to in just a minute, of infectious disease, of population displacement, and of dam collapse in case of disaster. Dams also illustrate another planetary health principle, as shown here. Each of these benefits of dams is expected to vary with climate change. In fact, in my part of the world, the amount of electricity we were able to get from dams declined by about 10% over the last couple of years with dry weather, because the flow of water The amount of snow melt that we had available in the spring and early summer declined, and that meant less water moving through the dams and giving us electricity. As we get changes in hydrology, changes in rainfall patterns, declining snow melt, we will see a decreasing function of many dams. The principle here is that any of the big issues we tackle need to be thought about not just in the present tense, but also in the future tense. We need to think ahead 5, 10, 20 decades because we know that we live on a rapidly changing planet. Next example I want to talk about regards the stuff we use, and I'm going to talk about plastic. Wherever you are now, sitting in your office, in your bedroom, outside on the porch, if you look around, I'll wager that you will see some plastic. It's a ubiquitous part of our lives. Now, plastic, as you know, consists of polymers of various simple molecules, be it ethylene or propylene or styrene, and plastic is used in a great many parts of our lives. Plastic is interesting in that it is part of the Great Acceleration. It essentially didn't exist before the mid-20th century, and plastic production has ramped up rapidly since then. It now exceeds 320 million metric tons per year globally, or about 40 kilograms for every man, woman, and child on Earth. That means that on average, each of us now alive will account for over 2,800 kilograms of plastic production over our lifespan, or 30 or 40 times our body weight. That plastic goes for packaging, for consumer items, for construction, automotive, and other uses as you see here. Not only that, plastic production is increasing as the world becomes more and more prosperous. It's expected to double or triple or more in coming years. So plastic is a growing thing. Now, plastic lasts a long time. If the workers who had built the Great Wall of China or Machu Picchu or the Taj Mahal 5 or 6 centuries ago had sipped water from plastic bottles during their breaks from work, those plastic bottles would likely still exist. Now, that matters. What happens to the discarded plastic is consequential. By one estimate, for every human being now alive, somewhere in the world there is about 1 metric ton of plastic. Some of it's in use, but over half of it is waste. Where does the waste go? Well, some of it's in landfills. Some of it's in waterways, a common and heartbreaking sight in many of the world's major cities. Plastic generally floats, so it travels with currents and accumulates in eddies, forming patches that can be as large and imposing as islands. From streams and rivers and harbors, the waste winds its way to oceans, an estimated 5 to 13 million metric tons each year. Driven by wind and currents, the plastic seems to go everywhere, making what seems a local problem a global problem. Plastic has been found in the deepest ocean trenches, in Arctic ice, in Mongolian mountain lakes, on remote island shores. The world's ocean systems tend to concentrate waste in the 5 great ocean gyres that you see shown on this map. Interestingly, the highest concentration of plastic debris ever measured on a beach was on remote Henderson Island on the western edge of the South Pacific Gyre, 5,000 kilometers from the nearest human habitation. Now, plastic waste comes in many categories, from macroplastics like the six-pack holder that literally shaped the life of this unfortunate turtle, all the way down to micro and nanoplastics, some of which are manufactured that way, such as the microfibers in our clothing, some of which breaks down from larger plastics into smaller plastics. Some of that plastic enters the food chain. We know that seabirds eat plastics, mistaking them for food, and an estimated 90% of seabirds, like this albatross, now have plastic in their bodies. But what's even more interesting, perhaps, is the way plastics, the micro and nanoplastics, get into the food web. This is a picture of the uptake of polystyrene beads by zooplankton. You can see them fluorescing green here in these pictures. And as you might imagine, here's the complex food web. The nanoplastics and the microplastics are taken up by very small critters, which are eaten by larger critters, which are eaten by larger critters still, eventually reaching the top predators like this orca or like this human being. We've now seen more and more studies like this one. This is a study of fish and shellfish bought in markets in Indonesia and California to check for the presence of plastics. In over a quarter of the individual fish that were sampled and in half the species that were sampled in both countries, plastic was found. When we eat fish, we eat plastic. And it's not just fish. As you can see here, this is a sampling of recent studies, whether it's sea salt or honey or beer, three of the basic food groups right there, many kinds of seafood. Plastic is found routinely when it is looked for. And of course, if you follow that right through the pipeline, it is in human feces as well in the one small study that has been conducted. So plastics are ubiquitous in our food supply. But plastic isn't just plastic, and that's one of the reasons for health concern. On average, 93% of plastic is the polymer itself, but 7% is additives, plasticizers, fillers, flame retardants, and so on. Not only that, plastic is a really good surface for absorbing synthetic organic chemicals. Some of these chemicals, such as polychlorinated biphenyls, are very persistent in the environment, hence the term persistent organic pollutants, and many of them are biologically active. In fact, environmental loading with chemicals such as these POPs, persistent organic pollutants, is a hallmark of the Anthropocene. And ingestion isn't the only way that these plastics get into our bodies. The consumption study that shows that plastic is found in so many foods also has shown that the mass of inhaled microplastics can equal or exceed the amount we ingest. This diagram is from a just published paper that quantified the plastic content of ambient particulate matter in the air pollution of China's Pearl River Delta. There was a substantial burden, with phthalate esters being the major species that was found in air pollution. Now, plastics, together with their fellow travelers, persistent organic pollutants, POPs, travel. The concept of biogeochemical cycles that used to apply to natural things like carbon, water, phosphorus, nitrogen might also be applied now in the Anthropocene to POPs. POPs are fat-soluble. They bioconcentrate within the fat of organisms such as fish, cattle, and polar bears. They're biomagnified as they move from lower to higher trophic levels in food webs, and they spread and oceanic transport as shown here, even in ecosystems such as the Arctic, far from where they were ever produced or used at any kind of scale. One recent study of Inuit people in the Canadian Arctic found that those with the highest blood levels of PCBs were 2 to 4 times more likely to have diabetes than people with the lowest levels. So the planetary health lesson here is that we can change the chemical composition of our planet, and we can do that in global ways. Even problems that seem localized can be global problems. There's another planetary health lesson, and it's a good one. We can make change. This is a map of where plastic bags have been banned or taxed around the world. The red means banning, and the green means taxing, and the brown is a partial ban or tax. What you can see is that many countries have stepped up to make a change and to respond. And interestingly, many of those countries are in the global south. They're low-income countries which are doing fine, making do without plastic bags and showing leadership. Here in our country, change is also possible. The blue states are the states where there are bans on plastic bags, and the light blue states are fees or taxes. But another lesson of planetary health is that there is a lot of resistance to change. These green states are states where there are bans on banning plastic. That is, local ordinances that want to ban plastic bags have been preempted by state law. This is a campaign driven by a lobbying group called the American Progressive Bag Alliance, representing the plastic bag industry. It's an independent division of the Plastics Industry Association. So there are lots of vested interests maintaining the status quo, and that's an important reality of the Anthropocene. The almost last example I want to show you is going to turn to food, and I want to talk about nuts. Now, nuts are an interesting kind of food. If there are any nutritionists in the audience, you'll know that nuts are actually very good for human health. In fact, we have quite a large literature detailing the nutritional benefits of nuts. Almonds and cardiovascular health. Walnuts are good for the microbiome. Pecans are good to reduce cardiometabolic risk. And if you talk to your nutritional friends, they'll tell you we should all be eating more nuts. In fact, in the nutritional world, lots of interesting questions arise about nuts. What components of nuts promote health? Can we make healthier nuts? How much should we eat of nuts every day? How do we get people to eat more nuts? But in planetary health terms, I would argue that there is one question about nuts that we don't ask or hear very much at all. Where do nuts come from? So we need to think upstream. This is part of planetary health thinking. Well, we all know where nuts come from. They come from the convenience store. They're in little plastic bags, and you buy them and you can just eat them as a snack. But if you go upstream from there, it turns out that nuts come from beautiful orchards like this almond orchard or this walnut orchard. Where are those orchards? Well, these two pie charts show where nuts are produced globally, in this case, almonds and walnuts. You can see that almonds are produced almost, better than 3/4 of the world's supply in the United States. Walnuts are about half from China and about a third from the United States. Within the United States, if we look to see where the nuts come from, they come almost exclusively from California, which has the lion's share of nut production in this country. Now, that's interesting. What do we know about California agriculture and the appropriateness of growing nuts in California? Well, this is a picture of the water footprint of various foods. And you can see that next to beef, the most water-thirsty food to produce on a liters per kilogram basis is nuts. Nuts take a lot of water to grow. What do we know about water in California? Well, we know that the last decade has been a hugely challenging time for California because of a prolonged drought. In fact, if you were just beginning from scratch, this might be one of the last places you would think about growing nuts, right there along with Phoenix, Arizona. It's not the place you would choose to put a water-hungry crop. Not only that, the forecast for coming decades under climate change indicate more chaotic weather extremes, more severe droughts, and less water from snowmelt. So the situation doesn't look like it's going to get much better anytime soon. So here we have a collision of nutritional advice with environmental stewardship. And that raises questions such as, is a cardioprotective diet sustainable? We need to look at the environmental aspects of the foods that we eat, as well as of many aspects of our lives, because the complex system analysis we have to do may lead us to slightly different conclusions than simply asking, are nuts good for health? Well, I've laid out some pretty challenging and even grim news for you, and you must feel a little bit of despair right now. It's actually pretty common to feel despair when you think about these planetary challenges. But there are great solutions in hand, and the last example I want to show you illustrates a great solution. This is the Diama Dam along the Senegal River. Not a major dam, it's only 18 meters high, but it helps to store water and support irrigation in surrounding communities in Senegal. 18 meters is high enough to keep the tide from pushing brackish water up the river. So after the dam was built, it created an ideal freshwater habitat for snails. Now you might recall that snails form part of the life cycle of the schistosoma trematode, or fluke, which is the cause of schistosomiasis. Sure enough, after the dam was built in 1986, snails proliferated along the river, and a fierce outbreak of schistosomiasis followed. But a win-win ecological solution emerged. That solution was prawns. This is a brilliant series of papers, the kind of thing that planetary health research yields, showing that when the river was stocked with prawns, which are predators of snails, a lot of good things happened. One was a dramatic reduction in schistosomiasis, improvements in health. Another was an improvement in health and well-being of people living along the river because they gained a dietary protein source and a cash crop in the prawns. So the solutions that emerge from fusing biomedical, ecological, sociocultural, and economic thinking can be truly inspiring. I want to close now by turning to the subject of hope. This is a picture of despair. And in fact, the planetary changes that I described are grim. I recently spoke about climate change to a university class, and I asked how many had confronted despair in considering the issue of climate change. Every hand went up. No surprise, despair is an occupational hazard for anybody who considers contemporary planetary change. But we need to fight despair. It's immobilizing, it's painful, and it doesn't accomplish anything at a moment when we have to be about accomplishing a lot. We need to embrace hope ourselves, and we need to inspire hope in other people. Fortunately, there's plenty of basis for hope, and it's with that I'd like to close. I'm going to show you quickly 8 reasons that I think hope is not only justified, but imperative, and here they are. First, co-benefits. Now, this is a good story. What we have to do to shift to a green, sustainable economy and to make the world a place that will last for our grandchildren, shown here, clean energy, well-designed cities that include alternatives to motor vehicles, plenty of green space, ecologically designed low-energy buildings, and so on. Healthy diets, meaning a shift away from resource-intensive meats toward diets that are a little heavier in plants. Green chemistry, so that we're not putting persistent organic pollutants into the environment. What if we lined those up alongside some of the major public health goals we have? Less heart disease, lung disease, and cancer, better mental health, less infectious disease and fewer injuries, healthier child development. Well, here's the good news. We have very solid evidence that clean energy delivers many of those public health goals. Much of that improvement is through cleaner air, but there are other pathways as well, each of them very solidly supported by evidence. We have very solid evidence that well-designed cities deliver those health benefits as well. We have very solid evidence that healthy diets deliver many of those health benefits, and that green chemistry delivers many of those health benefits. So the transition to a green, sustainable economy tackling these planetary health challenges is not a story of deprivation and sacrifice. It's actually a story of better, healthier lives. And that's good news. Reason for hope. Second, the technology is advancing. Here are just 2 examples. Batteries are getting better and better. When we have good batteries, we can facilitate the shift from fossil fuel electricity to renewable electricity. Batteries providing the electricity at times when those sources aren't delivering. Even such difficult sectors as aerospace are seeing massive leaps forward with aviation fuel that may be sustainably produced as well. Technology is advancing. Economics are improving. The costs of renewable energy have tumbled faster than anybody would have predicted, such that in almost every part of the world now, solar and wind are cheaper than fossil electricity. Policy is maturing. Many countries have made commitments to going to net zero by 2050, sometimes even sooner than that. Suriname and Bhutan are there already. A number of other countries have legislated a net zero commitment, and targets are under active discussion in 99 additional countries. They're being discussed today at President Biden's summit, and they'll be discussed in Glasgow at the next conference of the parties of the UNFCCC. Not only at the national level, but at the subnational level, cities are competing with each other to be the first city to go green and to go net zero. We're seeing really interesting legislative initiatives here in the U.S. as the fossil fuel infrastructure that you see here gets banned in place after place, and as infrastructure for the new green economy is advanced by cities that are forward-thinking. We are seeing activism blossoming, as exemplified by some of the pictures shown here, and that activism in turn motivates and pushes policymakers to pass the policies that we need. Public opinion is shifting. This is a picture of the proportion of Americans who are extremely or very sure that global warming is happening, denialism is falling, and belief in the problem is rising. In fact, here's an interesting little snippet of information on public opinion. This was exit polling by Fox News on Election Day this past November. 70% of the voters surveyed by Fox News favor increased government spending on green and renewable energy. So public opinion is coming along. Culture change is possible. Here I've found some posters from the Second World War. What you see is that the public was urged to use less electricity, to use less food and especially less meat, to buy local, don't buy things you don't need, don't drive if you don't need to. And you know what? Americans met that challenge and made those changes and did it willingly for the greater good. That kind of thing is possible, so we don't need to be cynical about that. Results are emerging. This is a picture of the growth of renewable energy. This is hydro in blue. This is wind in red. Other renewables up above. It is growing very, very fast. In fact, a big milestone was that last year, renewables pulled ahead of coal. So change is happening. Even in the private sector, we're seeing enormous leadership. This is the automotive sector, and car companies are competing with each other now to be the first ones to go all electric and to provide us with the best choices of electric vehicles, which are much more environment friendly, climate friendly than our traditional internal combustion engines. So for all these reasons, there's no need to despair. There's plenty of reason for hope. Well, I've tried to give you a quick run through of the concept of planetary health, the health of human civilization and the state of the natural systems on which it depends, a framework for doing science and for developing solutions that is people-centered, that is systems-based, that faces upstream and looks at root causes, that is committed to equity, that is oriented toward the future, that is solutions-driven, and that inspires hope. I want to thank you very much for your attention. Wish you all a happy Earth Day, and I look forward to the Q&A.
Excellent. Thank you so much, Dr. Frumkin. That was very thought-provoking. I echo a comment from our audience. Very thought-provoking topic. I will always think twice now when choosing nuts or a bottle of water on an airplane, which is the standard fare. There are a couple questions that I'll consolidate into one. When you think of sustainability, you think of the next electric cars, there's battery operated. Would like your thoughts on the sustainability of those new technologies because of resources taken to create the batteries and then recycling.
Well, a great question, and nothing is perfect. Life poses us with a lot of trade-offs, and one of the points I tried to make with dams, which are a great technology, is that even dams have their downsides. Mm-hmm. So electric vehicles they're much better in terms of greenhouse gas emissions than internal combustion, but they're not perfect. So I think moving toward walking and cycling, moving toward a greater use of transit, developing the technology that we're all using now, the telecommunications, means that telecommuting can become more and more of a reality as we emerge from COVID, and that means reducing travel demand. So there are many dimensions to a complex problem, and transportation is a great example. We are going to have to continue to use resources to travel. There's no way around that. But if we think in a multidimensional way, and if we tally the environmental benefits and the health benefits of each of the possible solutions, we can optimize the answers we come up with. What I'd recommend to everybody is, if you have an internal combustion engine vehicle, think about an electric one. If you have an electric vehicle, think about a bicycle. If you have a bicycle, think about walking, because walking and cycling are going to be healthier for you than driving any kind of vehicle. And if you have transit and can use that, that's great. That's one of the lowest carbon footprints. And by the way, the walking to and from a transit stop, whether it's light rail or a bus, builds in daily physical activity to your life. So the benefits we get from that: cleaner air, physical activity, fewer car crashes, less noise in our cities and towns, multiple health benefits. And so it's one of those many places where, as we make the best decisions we can, knowing that no decision is perfect, we can optimize a lot of good outcomes.
Excellent. With the last amount of time that we have with you, I would like to ask your ideas. We're a research institution. Many of our attendees are scientists. What do you see as the next and the biggest research questions and areas that we need to move forward on?
Well, I think we need to understand health threats. And so this is, if you will, the diagnosis part of the issue. How will climate change reduce the nutrient content of foods? How will rising sea levels affect habitability of cities? Many, many questions. We know a lot about the impacts of global environmental change, but there's a lot we need to know. Second, we need research on solutions. So what sorts of crops will be most viable in the world 50 years from now, most nutritious, most economical to grow? What sorts of heat wave preparedness plans are going to be most effective at protecting people from the impacts of heat? So there's a whole science we might call solutionology, developing solutions to protect people from the hazards that we document with research. Third is co-benefits. So as we do things like change our transportation system and change our energy system, we need to understand which ways of doing that are as health promoting as possible. So that means linking health research with research in energy, transportation, agriculture, and so on, so that developing environmentally friendly ways to do all those things also develops healthy ways to do those things. We need a lot of social science research. How do we communicate these issues to the public? How do we change policy? Why is there a no-do gap? Why do we know many of the things we need to do, but we don't do them? And how do we overcome any of those social and political barriers? Across all of that research, we need to be very multidisciplinary. And that means for those of you who train students, don't just train them in toxicology, but do a little ecological thinking, do a little geographic thinking, and blend all of that. We'll be hearing from NIEHS in the next session. One of the very promising things is that we're seeing more and more move toward interdisciplinarity and synthetic science through funders such as NIEHS.
Excellent. Well, I in the audience want to thank you immensely for your deep dive into the issues that we are facing, but also the hopefulness that you've brought to this conversation that we can make change. So thank you. Thank you so much.
Thank you very much for the opportunity.
Fantastic. Excellent.